When to do what investigation in urinary tract infection. In fact, we diagnose urinary tract infection with typical clinical symptom, digestic, nitrate stearase, pyuria, and other parameters, and now your urinary microscopy and your culture finally. So the when to do other investigations with the clinical resolution in the fast attack, we usually do not do ultrasound. But when there is recurrent infection, we usually go for an ultrasound. If ultrasound shows the obstructive repetitive features, we go for the MCU and RGU. So ureteric it evaluates the lower tracts, the urethra, bladder. But to evaluate the ureter, the best one is the CT urogram and MR urogram. CT a little bit toxic and nephrotoxic, so without contrast you can do it at times. But MRU is safe, but it needs a little bit sedation, and child must be calmed. Kidney evaluation is your can be done within the DMSA DTPA. Usually, the toxic dilatation of the urinary tract confusing. Thereby, we avoid doing it in first 3 months, 1 month or so. After 4 to 6 weeks, we go for an ultrasound. But in acute stage, we need to do it at times when there is pus collection. You need surgical intervention, right? There is perinephric abscess, and there's something acute sort of things. You need to go for the nephrostomy and pus drainage. So you're right. In acute stage, you need to do it. At times in acute stage, we do diffuse weighted MRI. It is helpful in exam to diagnose the acute pyelonephritis. So what you do in 1 to 2 months or 3 months, you go for an ultrasound. If it shows the dilatation or the obstruction, you go for the MCU. And to know the scar, you should best test the DMSA. It tells you also the function. DTPA or MAC3 phase 3 stage investigation imaging, the renography, glomerular phase, parenchymal phase, and excretor phase that tell everything so well function and in different phase obstruction, glomerular lesions and parenchymal lesions. So it is to be done in a good amount of cases. And IVB, intravenous pyrogram, is nephrotoxic, but it delineates the whole urinary tract. It's so good. The people still to know the anatomy, do it. So, and apart from that, you have CBC, you have procalcitonin, you have the polymorphic leukocytosis and ferritin to assess the systemic toxic acute pyelonephritis.